Good afternoon, and welcome to our weekly COVID-19 update for the town of Plymouth. I'm Steve Triffletti, your Plymouth Town Moderator, and we're here each Wednesday at noon for this update. Today will be an abbreviated presentation ending at 12:50. This forum is being brought to you live by Ppp2 at Comcast Channel 15, Verizon Channel 47. You can also watch this on Ppp2's streaming channel by going to ppp2.org/live. For questions during today's forum, please email plymouthinfo@ppp2.org. These forums can be replayed at ppp2.org/Plymouth. Today's participants include Dr. Barry Potvin, Sarah Cloud, Dr. Christopher Campbell, Heather Cozby, Stephen Cole, and Matt Muratore. And we're going to begin, as we do each week, with our medical segment. And we once again welcome Dr. Barry Potvin. He is the chair of the Town of Plymouth Board of Health. Welcome, Dr. Potvin.
Yes, thank you, Steve. Given the time limits today, I'm going to try to be as brief as I can. There's a tremendous amount of information that I could share with you. We won't have time to go through all of it. So please be aware that today at 4 o'clock, there's going to be a Board of Health meeting, and the COVID-related material will start at about 4:45. We encourage everybody to tune into that if possible on Ppp2. There's also a huge amount of information that was just posted on the town manager's report, and you can find that also on the town website. So what I thought we'd do today is just give you an update quickly about what's going on in Plymouth. The positive cases of COVID and the hospitalizations seem to be finally starting to level off after the holiday surge that we experienced. There is, however, still a increasing number of people who are dying from the disease. Usually the deaths are the last thing to sort of taper off. It was sort of disturbing to see 5 new deaths in the last 3 days here in Plymouth. There's now approximately 125 people who have died since March of this disease in Plymouth. And there's been 3,180 positive cases in Plymouth. Probably somewhere around 5% of the population. In terms of the deaths, I wanted to also point out that the town bell is going to be rung at 4 o'clock on the last Sunday of each month. So that'll be this coming Sunday. It is rung once for each person who is a resident of Plymouth who has died of COVID. It's quite a striking, emotional sort of thing to witness. But I hope those of you who have the emotional strength to do so will try to be there to hear it. And if you come, please make sure you stay far enough apart from each other and wear masks. So that's one of the things I wanted to make sure you knew about. There's still a concern going on about these new mutant strains of the virus. They occur naturally. The more people are infected and the more virus replication occurs, the more of these will pop up. The ones they're worried about at the moment are from the United Kingdom, which has already been found in the US, one in South Africa and one in Brazil. There's concern about those because they seem to be more easily transmitted and infectious. And at least the one in the United Kingdom also seems to be somewhat more dangerous. The good news is that so far it seems that the vaccines still function against those. So I'll just show you quickly a little bit of information that I have for you. If I can screen share this quickly. Can everyone see that? Please.
Yes, we can.
Yes. Okay. So this is done every Thursday. It's based upon the weekly results that come out from the State Department of Public Health. And this is just the number of average daily cases per 100,000 population over 14 days. We've been doing this ever since August. And as you can see, we had quite a spike in this in Plymouth during the post-holiday period. Still going up a little bit, but the preliminary data that'll be coming out on tomorrow looks like this is now starting to go sort of flat and maybe starting to fall off a little bit. In terms of what's going on in Massachusetts overall, you can see that the number of red communities, which are those at high risk, has already started to sort of taper off. and it's becoming flat or just slightly decreasing with time. See if I can get you, maybe want to do this one instead if I can. Let me try to get this, the screen share up.
Does it make sense to you?
This one here. So this is something we also do every week on Thursday. It's just the calculation of how we determine red versus yellow and what's going on here in Plymouth. And as you can see down at the very bottom of this is the calculations that gave us that 89.4 average daily positive case rate per 100,000. This was the material that was published on the 21st, and the positive test rate was 8.97. We're hoping that this is going to be going down a little bit as soon as we get the new data on Thursday. So let me now go into the information about the vaccines. So if you look at what's going on with vaccines, they are just about to start what's known as phase 2 of the vaccine distribution. And I can show you also the information about that, which is right here. So phase 1 is almost complete. Everybody that's listed here in phase 1 are now getting the vaccines or already have. There's varying degrees of acceptance for those that actually receive the vaccines. So far, the staff working at congregate care settings seem to be the ones that are most resistant to getting the vaccines. They found that something like 52% of the people that could get it actually accept it, whereas the people who are actually residing in these congregate care facilities are getting it at a rate of about 84% acceptance. So that's a problem. Also, there was reports that the people at the jails, again, are not accepting the vaccine in large numbers. So there's vaccine doses left over in those areas. Phase 2 starts February 1st, which is this coming Monday. It's initially for people who are 75 and up. So I don't imagine anybody sitting at this panel right now would probably be eligible yet. But you can, if you are, you can register with the state. There's a website to do that. And there's a small number of areas and sites where you can get the vaccine. If there are appointments available, you must do it by making appointments. After that group is in progress, at some point they'll expand it to those who are 65 and up and individuals with 2 or more comorbidities that have increased risk for the illness. Then they'll expand it to people in education, K to 12 people, all the teachers, school staff, grocery workers, utility workers, food and agriculture workers, sanitation workers, public health workers, public works workers. And finally, they'll go down to people with just one comorbidity. That's going to occur starting February 1, and it'll gradually move down the list, probably getting towards the end of this group sometime late in March or early in April. So that's who's eligible. There's a way to fill this material out, and I'll quickly show you the, if I can get this one to go. That's over here. So this is the website that you'll go to that's run by the state. And it's easily accessible. It's basically the COVID-19 vaccination locations for individuals in eligible groups. And as you scroll through this, you notice there's a thing about how to find locations. And then notice that they put this little warning in. High demand, very constrained vaccine supply. So the COVID-19 appointments may be very limited. More appointments will be available as soon as more supply is available from the federal government. And then appointments will be added on a rolling basis at each of the sites. What's a little troubling to us, and Matt knows this all too well, as I do, because I've been fighting this with the state for more than 2 weeks now. If you look at what's available around Plymouth, you notice that there's these blue stars. If you click on one of the blue stars, that's Hanover. It's about a 29-minute drive from Plymouth. It's at the CVS. It says eligible population statewide, so anybody can go in here and get a vaccine if you can get an appointment. It's an indoor site. It's actually in the CVS itself. You must check in 15 minutes ahead, and they're open daily to do these vaccinations. The next closest is probably here. That's the Hannaford Pharmacy in Middleborough, about the same sort of driving time away. And there's also one that's in Halifax at the Stop and Shop. That's a little bit further. It's about a 35-minute drive. If you look further down, you'll see a Mashpee at a Walgreens. That's probably about a 43-minute drive, but it's still open to everybody. And then there's the big one, which is Gillette Stadium. And that one is one of the mass vaccination sites that's run by the state. It's available to everybody. Again, you have to book an appointment. You notice whenever you go to one of these locations, you see this little website. To book the appointment, you just click on that and you follow the instructions. Unfortunately, for those 75 and over, you have to be a little bit adept at using computers and having internet access to do this. The state's aware of it, and they're going to try to put in some kind of phone service so that you can get someone to help you with it. Foxborough for us is probably about a 70-minute drive from here. So we looked at this and we said, oh my gosh, we're dealing with 3 little drugstores that are kind of nearby. And then you got to drive an hour and a quarter to get to Foxborough. And what's wrong with Plymouth? And we get so many messages about why isn't there a site in Plymouth? Bottom line is we've been trying, and we've been trying and trying and trying. It's not for lack of effort. There was some talk about trying to get them to put one at Memorial Hall. Then there was more talk because we discovered there was a huge space available at the Kingston Collection Mall. And the state actually said, this looks like a great site. So far, it has not been approved. There is apparently someone who's a scout for the state that looks at these sites that should be coming down to have a look soon. It's a little discouraging because there's only going to be 7 of these big mass vaccination sites statewide for the moment. And 5 have already been identified. 1 is supposed to be somewhere in Southeast Massachusetts. Hello, that's us. And there's a lot of talk mostly about New Bedford. Why are they putting them here? And why are they putting them in various other places like Fenway Park? They seem to be mostly looking for places that have high density populations and also places that have a large number of people who are generally low income and have been suffering the most from these kinds of problems. I can give you a lot more information, but I'm going to sort of hold off on that, and I'll cover it at the Board of Health meeting later on this afternoon. And hopefully, if there's any time left, I'll be available to answer questions.
Thank you. That's Dr.
Thanks.
Barry Potvin. He is Professor Emeritus, Yeshiva University, Department of Biology. His questions can be sent to PlymouthInfo@pactv.org. And now we return and welcome back Sarah Cloud. She is Director of Behavioral Health at Beth Israel Deaconess here in Plymouth. Sarah, we hear people are concerned, I guess stressed about the new strains of the virus and how they may or may not affect some people locally, as well as just trying to figure out how to get the vaccine. So what are your thoughts today?
There is so much to unpack when it comes to the vaccination process, Steve. There's when and how will I be able to get the vaccination? Will there be enough for a second dose? Is it safe? Why is the rollout process taking so long? I think it was really helpful to get some feedback from Barry on that, some insight. Other questions we're hearing often is why are the other states able to roll this out so much quicker? Why are some populations prioritized over others? And what if other people aren't going to get vaccinated? What's the point? So I'm going to fall back onto my common themes and strategies that we regularly talk about on these sessions and kind of break it down a little bit to kind of help us cope and think through this process. So first, I think it's really important that people feel comfortable with their decision about whether to get vaccinated or not when the time comes that they have that option. So I'm going to highly recommend that folks do their research. And like politics, don't try to argue the point with others on social media or, in other ways. You can certainly share what you've learned if the other party is interested in your advice, and or you can just encourage them to do their own research. It's also important to get your news from trusted resources. The website that Barry just showed us is probably the number one go-to here in Massachusetts. It doesn't matter what other states are doing. It's really important to understand what our state is doing and focus on our current resources. And then think about limiting your overall consumption to news outside of those sources. Because I think that there can be some social media posts and other things that are really concerning and confusing. So we just really want to be careful about focusing in on trusted news resources and keeping it limited. Also, my number one thing I keep talking about over and over again, probably tired of hearing about it, but focus on what you can control and what you can't control. So just like you can't control whether somebody else is going to wear a mask or physically distancing, you can't control if they're going to get vaccinated or not. So kind of focus in on what's causing you stress. Think about it. Is it something I can control? Is it something I can't? Let it go if it's not within your control. Also set reasonable expectations. I know I talk a lot about that. So the expectation is that we know this is going to take a while and it's going to be a challenging rollout. We have never rolled out mass vaccinations like this before, and it's a work in progress with a steep learning curve. On a much smaller, scenario, I've witnessed this process happen within the hospital and within healthcare. And there was a lot of similar frustrations and challenges and concerns that's happening on a much larger scale. And the bottom line is that it moved through fairly quickly. We learned a lot, and everyone was able to be offered a vaccination, in a fairly short period of time, considering. So this is just going to play out on a much larger scale in the community. It's also really important to note, in terms of setting expectations, that once vaccinated, which takes a number of weeks, if not longer, to get the full effect, we're still going to be wearing our masks and physically distancing. That does not change in the immediate future. Also practice kindness and patience. We've never been through anything quite like this before. Please don't take your frustrations out. And your frustrations are natural and understandable, but please don't take them out on the frontline workers. It's not going to help anyone. So please seek other outlets, whether it be exercising, volunteering, writing your legislators, other avenues or outlets for your frustrations and concerns. And then lastly, help others. As Barry already mentioned, this next phase is for people 75 and older, and navigating this information and process is challenging for anyone. I spent a fair amount of time this morning on that website already, trying to assist my mom in getting her accessing her vaccination. So, seniors have limited access or knowledge of technology, and it's very complicated to navigate. So try to help your family, your neighbors, and other members of the community. So we're going to get through this together. Thank you.
Thank you, and that's Sarah Cloud. She is Director of Behavioral Health at Beth Israel Deaconess here in Plymouth. She's available to answer questions. Send them to PlymouthInfo@PACTV.org. And now we move on to our educational segment, and we welcome back Dr. Christopher Campbell. He is the Superintendent for Plymouth Public Schools. Welcome, Dr. Campbell.
Good afternoon, Steve. Thanks again for having me. I always like to start by providing an update regarding our COVID cases in the school community. So this past week, we reported 47 students currently confirmed with positive COVID-19 diagnosis. We had 126 students quarantined, 9 employees that were COVID positive, and 19 employees that were quarantined. As been our practice since September, when we first introduced our dashboard 18 weeks ago, the data reported has been confirmed by the state through Mass Department of Public Health's MAVEN online information system. So we immediately update our school communities, however, each week when a positive case is reported through letters to individual families and to staff. So from time to time, there may be a lag between the letters that are sent to the state's reporting of cases in MAVEN Actually, many of the cases, 23 this past week, reported on our dashboard, were already reported to staff and families through letters a week or two ago in some cases. So they're not all from last week. So I just wanted to clarify that for the community. We did certainly see a spike in cases, both during the holiday break and the week after, similar to what Dr. Potvin was saying, with the overwhelming number of our cases resulting from a connection to a student gathering, which we've talked about through social media and other means. But similar to Dr. Potvin's report, we're happy to see a decline in confirmed cases this week so far, though. On a related note, as a district, we have been exploring COVID surveillance testing. We've been exploring COVID testing options for both staff and students. And originally, we were exploring a process called COVID pool testing, which I believe I spoke to about on this show once before. In this case, COVID pool testing would be a pool or a batched test, taking individual tests and then following up with a rapid test for any positive pool test results. Logistically, we had several concerns as to how our schools and our health offices particularly could take on such a task of this nature, which would require considerable oversight and management. Recently, we became aware of another testing option that we will be moving forward with in the coming weeks. We're in the process of securing a confidential, no-cost COVID-19 surveillance testing option for district staff and students to participate in if they choose, to assure our commitment again to the optimal health and safety of our school community while maintaining a safe in-school learning environment, which we've been doing since the beginning of the year. This specific test that we want to offer is a PCR test, which requires individual consent and authorization. It is a molecular test. It's highly accurate. It does not require us to repeat testing. It's all individualized. It utilizes an individual's saliva, so it's the most non-invasive measure. It diagnoses active coronavirus infection, and we'll get the results within 24 to 36 hours, which is really good. So the purpose of this testing initiative is to offer our community an option, again, for convenient, randomized surveillance testing during the remainder of this school year, as well as provide an opportunity from returning from week-long breaks during the months of February and April. So in addition, we also hope to include testing options at other times, such as when a member of our school community may develop rapid symptoms during the school day. Testing, we can do that testing prior to dismissal through the health office. A member of our school community may be deemed a close contact, so this will be another option for us. As I said, we're hoping to get this new initiative in place in a timely manner, and have been very thoughtful about the process and been getting feedback from families and from staff to roll this out. So we recently sent out a survey to gauge interest, and we've already had significant interest expressed by staff and families, and we hope to begin this in the coming week, as I said. We talked about vaccinations already. I know Dr. Potvin mentioned that. We're happy that our teachers will be part of the phase 2 rollout. We understand that there's a lot of need for vaccinations, and a lot of people, many people in our community that we must prioritize. We're very happy that our school nurses were included in phase 1 with our first responders. So all of our health office staff and nurses concluded their vaccinations as late as this past Monday. So that was very exciting. And we understand that there are many that need to be vaccinated in the coming months ahead, weeks and months ahead in the general community, but we will do everything we can to support that process for our staff in the future as well. I wanted to take a moment to talk about the return to school. So many people have asked me over the weeks when we could consider returning to school in a full-time nature. And while the vaccination of our educators will go a long way in considering the reopening of our schools for a more full-time model, the Department of Education has placed significant restrictions on districts regarding transportation of students on buses. And I've spoken about this in the weeks past, but currently we are only allowed to transport 23 students on a large school bus, which is 1/3 capacity. We have one of the largest bus contracts of any town in the Commonwealth, larger than most regional districts, in fact. We run a 3-tier bus system each morning and afternoon with between 60 and 68 buses at a time for our elementary, and secondary students. Our bus contractor does not have enough buses in the fleet nor spare drivers to accommodate 100% of our qualified riders on a daily basis under those restrictions. So I'm hopeful that in the near future, the Department of Education would be issuing revised guidance to districts in this area, which would be a considerable barrier for us if we were looking to move in that direction in the future. We're very large, and as I said, it would be a significant barrier for us. So that's all I have to report today, Steve. Of course, I'd be happy to answer any questions that the listeners may have at the end.
Thank you. Let's talk to Christopher Campbell. He is the superintendent of Plymouth Public Schools. We now move on to our business segment. We're going to begin and welcome back once again our resident Plymouth CPA, Heather Cozby. Welcome, Heather. And a lot's been
Hi, Steve.
going on.
Thanks for having me back. I'm excited this week because I have a lot of details about some of the PPP changes that happened that I didn't have the last time I was on. So to start with, I'm going to start with the forgiveness process and kind of update the small businesses here in Plymouth. So SBA issued their new forgiveness application for loans under $150,000 on January 19th. So that just happened, and I have heard some banks saying that they are not going to be ready to start receiving that new application until about mid-February because they have to build their systems. So, so please continue to be patient. You're going to want to use this one-page form. The form is called a 3508S. So you don't want to use any other forms because they're going to require you to do a lot more work, basically. This is a one-page form where you're going to estimate your numbers. You're going to sign off that you have your documentation to support these numbers should you be audited in the future. And then you're going to submit that, and that is the end of your forgiveness application process. So that is wonderful news. Definitely wait for that. It could be another month so you can complete that form within your bank. So one of the other things that I've been getting a lot of questions on regarding forgiveness is, do you have to have your first loan forgiven before you apply for your second PPP loan? And the answer to that is no. So don't worry about trying to get the first loan forgiven before you move forward with your second loan application. So for the second, the next part I'm going to talk about are the Ppp2 loans. So if you're interested in going and getting a second round loan of that loan, that is up and running. That's been running for since January 11th by SBA. There's approximately 400,000 applications approved by SBA, distributing about $35 billion of the funds. So it's tremendous. I wanted to just take a moment because it's hard to always listen to what I have to say because it's technical. I'm going to actually switch and show you some of the information on the screen and some of the websites and how to maneuver through them and get you some additional information. So I think it's up and running, but I don't know. Hold on. There we go. Okay. So I keep referring to the SBA.gov website. I wanted to actually show it to you because it could be a little easier to navigate. But basically, when you come here, you're going to click on this Learn More. And once you're in here, click on the first link. Down here, it's second draw loan. So this is where you're going to get information about the second round of PPP funds. Are you going to qualify? But what's really nice is once you get to this part of the website, on the left, you can see you have all of the various subtopics. Why they don't put this on the first page of the website is beyond me, but they didn't ask my advice. So this is really where you're going to get all the information that you need. So some of that information includes an overview of the second round. So here what's important is that in order for you to qualify for a second round of PPP funds, you need to demonstrate that you had a 25% reduction in revenue for 1 quarter of 2020 versus 2019. One of the other items it shows you is how do you figure out if you've had that happen for you or not. So there is a ton of information on this SBA website that I wanted to make sure people actually saw it and could see some of the information to move forward with. So this is also great information. A lot of concern I hear are people going, only big companies are getting the loans. Of what's been distributed, here's the average over here, loan size. These are definitely serving the right, small businesses. I wanted to show you how many applications have been done. This is just what's happened in maybe less than 14 days. So for businesses, if you're thinking about getting this funding, you have until March 31st to submit your application, but funds may exhaust before then. So you want to get moving on this. That is going to be really important. One of the other things that I wanted to go over, and I'm sorry I'm having a hard time seeing it, was I wanted to show you guys the IRS website. So just to start with, the IRS tax season officially starts on February 12th. So what that means is that's about 3 weeks behind normal. So yes, you're going to experience delays getting refunds. But going to the irs.gov website, you can probably get a lot of your questions answered. So you'll see right here, do you want to check on your economic payment, the payment you're supposed to get that just happened? Check on your refund. You can get a lot of information right on this website. So I wanted to at least show the Plymouth community what it looked like. And with that, I wanted to show you Massachusetts as well. So Massachusetts expired on me. Okay. So mass.gov has something called Tax Connect, which gives you an equivalent resource, but I'm sorry it expired on mine. So basically you can go and you can see what's your refund, you can set up an account, you can make payments, you can do a lot of information there. And then the last item I wanted to show you was what I'm getting a lot of is, we talked about it when unemployment benefits started coming out. There's a lot of unemployment tax fraud going on. And then what's happened is taxpayers are starting to receive 1099s from unemployment regarding benefits they received, except they're fraudulent claims. So what do you have to do? If you're getting a 1099 form that's saying you received unemployment income, but you didn't because you were a victim of national fraud scheme, you need to go to the Mass Department of Unemployment and you need to fill out this fraud reporting form. So when you click on this, it's an actual online form that you're going to go through and you're going to provide this information so that you can let them know, hey, don't try and tax me on this income. I don't need to start getting all these notices from various agencies saying I didn't file my tax return correctly. So that's a really important piece that I wanted to make sure people knew was there. The state already has it available to you. So that's kind of an update on what's going on, what taxpayers are talking to me about, how COVID's affecting the taxpayer, the filing season, and of course the PPP information that's never ending. So I look forward to answering any questions.
Cozby, she's a CPA in Plymouth, and she's available to answer your questions. Send them to plymouthinfo@pactv.org. And now we're going to move to the second part of our business segment, and we welcome back Stephen Cole, and he is with the Executive Director for the Plymouth Regional Economic Development Foundation. Welcome, Steve.
Hi, Steve. Glad to be back. I'm sure folks at home did not see this, but my computer just did a critical update and I was booted from the internet. So glad to be back. I wanted to share with folks, in case they hadn't seen it, some comments from the governor's State of the State address earlier this week. I won't go through the whole thing, but I will tell you near the end, there was some really substantive stuff that he mentioned. And paraphrasing here, he said that one thing we have to make sure we get right is the future or the status of work. And really what he means is, naturally, people are going to change their behavior as a result of all this. They're going to be working from home more often, we expect. Travel, transportation, climate change, there's myriad other policy areas that are affected by this also. And I think that there's some great stewardship coming out of the governor's office, but also some great forethoughtfulness about what we're going to do as a state to adjust for this. And something else that came up earlier this week that is actually parallel to this is the number of what they call the FAFSA applications, the free application for federal student aid. Economic development, of course, focuses on enhancing quality of life. One of the ways that we do that is by enhancing education. Learning never ends, be it workforce development or secondary and post-secondary education. 14% fewer applications have been filled out this year compared to the same time last year. That just simply means that there's going to be 14% fewer people who are entering college, perhaps, or at least seeking federal student aid. What's really more telling to me was that in 2020, the freshman class saw a 22% decrease in enrollment, and that's also a 33% decrease in enrollment for areas that are higher poverty districts. How does this relate to economic development? Well, frankly, if people aren't going to be achieving those academic thresholds that qualify them for higher levels of academia or employment, frankly, we need to do something to help fill in those gaps. I'm an advocate for education, but I also believe that, at least in terms of entrepreneurship, not everyone has to go to college to realize those types of dreams if they have an idea in mind and they have a product. That said, one of the things I'm most proud of coming out of the foundation is probably the most comprehensive and collaborative effort we've done so far. The town of Plymouth right now has an RFP that we wrote that is being prepared to be released. The purpose for the RFP is to hire a qualified firm to study entrepreneurship in Plymouth, not just who is here, but also who can we attract. Also, what types of support systems exist? If there's a deficit in that support system, we need to focus on enforcing that so that they feel comfortable starting and growing their business here in Plymouth. The RFP will be out at least until the beginning of March. I suspect that we'll have the preliminary reports available as soon as June, and we'll wrap it up by July. This report will be ultimately a implementation strategy that we're going to turn around and use as a basis for our application to the EDA for funding to implement the strategies that are outlined in that report. My sense is that we'll find some need for to build on what TechEtch is doing with their innovation center. We expect that we'll have something like a professional office setting, something like what you see at CoWork, Duxbury, and Cape Space. We're pushing for hackerspace, makerspace, tinkerspace, 3D printing. The nature of restaurants and food prep is, of course, changing. So we're going to be focusing on things like ghost kitchens. We're going to achieve a vertically integrated entrepreneurial center that encourages people to think about the types of jobs they want to have, help take their product to a market, and then frankly, hopefully, start a business here in Plymouth. Ideally, this RFP that is before the purchasing office in the town of Plymouth right now will help us create a business that creates businesses. So I'll pause there. I'll relax for any questions that come back at the end of the program. But thank you, Steve, so much for the opportunity to share this with you folks. I look forward to coming back and giving you updates as we move through the program.
Thank you, Stephen Cole, Executive Director, Plymouth Regional Economic Development Foundation. We now round out our panel with each week we welcome State Representative Matthew Muratore. Matt, what do you have for us this week?
Hey, Steve, how you doing today? Listen, we've gone over the 13 million mark in tests here in the Commonwealth. 4.5 million of those have actually been first-time tests. So and the population, the total population of Commonwealth is 6.9 million people. So, getting close to almost every single person being tested at least once. The hospitalizations, as Dr. Potvin mentioned, have gone down. We are now below 2,000 at 1951. Back on January 4th, we were at 2,400 folks in the hospital. I want to just briefly talk about the vaccination sites. And I know I've asked Donna Rodriguez from PAC TV to put up this website too. The mass.gov/COVID vaccine website is the website that you want to use. I know in the past I've talked about all these different websites. This is the one you want to get to now. Now the problem is at this point, it just opened up at midnight tonight for appointments, and all the appointments are booked at this point. But it doesn't mean you don't keep trying to do that. As more vaccines become available from the federal government, then we'll be able to open up more appointments for these folks in phase 2. So right now there are 103 vaccination sites opened, or will be open by the end of this week. That includes some of the places that Dr. Potvin mentioned on the map. I look at this a little bit differently. We have been working actively with the state for the last couple of weeks, actually 3 or 4 weeks, on a positive note, trying to get something in Plymouth. It's not for a lack of not wanting them to do it. It's a matter of logistics and getting the whole state up and running. So the state is aware that there is an opening in this area, and we are working on it. The Board of Health, with the leadership of Dr. Potvin, gave a great information on the Kingston collection, which is a viable site that's being looked at as a possible site like Gillette Stadium, because that could give about 5,000 doses a day. I'm sorry, a week in a place like that. So we are still working on that. There's still, by the mid-February, there'll be about 165 to 170 sites that will be open. And what's happening now is the sites will be open, but there may not be enough vaccines in those sites yet. As you know, the Biden administration is working on the supply of vaccines to get more vaccines into the system. Right now, we have 876,000 vaccines that have been sent out to different providers in the Commonwealth, with about almost 500,000 of those being distributed. This week, the state is not providing any more vaccines to hospitals until they start working down the supply that they have. A lot of hospitals have supply of vaccines that they're holding on to and starting to give out, so that will happen this week. And the other thing I wanted to bring up, Steve, I know everyone wants to be first. Everyone wants to get the vaccine. They want to get it now. People are anxious, and I really appreciate when Sarah was on and she talks about, the anxiety and, and the situation that we're in. I've got some teachers now that are upset because now older people are now getting it before them. We had people that were upset that the nursing home patients were getting, or residents were getting them before other people were getting them. This is all a matter of judgment and what the best course of action is. I know there's been talk out there that the Commonwealth is like 28th behind other states and with regard to the distribution of the vaccinations. But what the Commonwealth did differently than most states is we took the most vulnerable population and people that can't get out to get vaccines. And so just think about that and the distribution of how you get vaccines to people that can't get out, people that are in nursing homes, assisted living, rest homes, homeless people, congregate care living, prisons, all those people. They can't get out to get it. So it was decided that because of the limited amount of distribution of vaccines we were getting, we'll get to those people first. And it's not just the first round we have to get them, we have to get them the second round as well. So we may be 28th in the country at this point, but very quickly we'll ramp up and we'll be getting closer to the beginning of this and getting more and more people done. It was just a matter of prioritizing. You could say it was right, wrong, or indifferent. But that was the strategy that was taken. Now we have phase 2, as you know, is opened up. That will be starting Monday for those folks over the age of 75. And then right behind them will be people age 65 and over. And then everyone, early childhood, K through 12 workers, transit workers, grocery workers, utility workers, food workers, public works, public health workers, et cetera. So, and phase 2 will last probably through February and March. And again, relying on the supply from the federal government, we should be able to get to phase 3, which will include the general public, by April. So we still are on track for that, Steve. And that's my update today.
And that's Plymouth State Representative Matthew Muratore. We're now going to go back through our panel. I do have a couple of questions, and we'll do that as we get their closing thoughts. We're going to begin with Dr. Barry Potvin. And Barry, as you give us your final thoughts, one question for you. A viewer writes, I'm hearing that I should wear 2 masks. Is that true?
Yes, thanks, Steve. There is a very important recommendation that you wear 2 masks. The one that you wear directly on your face would be the surgical type masks, the ones that are kind of blue and probably made out of paper material. And then you cover that with a cloth mask. That gives you additional protection. It also provides protection to the people around you. So yes, it's been a widely dispersed sort of recommendation, and even at this time when people are in the process of trying to get vaccinations.
And Dr. Potvin, what's your takeaway today?
Any other questions? Or should I? Well, I'd be remiss if I didn't thank Matt and Sue Moran, also even the president of the BID Leahy Hospital. And they've all, to my knowledge, put a lot of time and effort into trying to encourage the state DPH to look favorably upon putting a vaccination site close here in Plymouth. And I know a lot of people are doing a lot of work on that. I even consulted with the county commissioners. But basically, the bottom line is, please remember that this is not just because vaccines are starting to come out. It doesn't mean that this pandemic is over. We still have to exert some caution. You need to keep wearing masks. You need to keep physical distance from other people. You need to be very careful about being close to other people who may not be wearing masks, whether inside or out, but especially inside. And you need to, of course, stay informed. So we're doing our very best, not only to fight for a vaccination site here in Plymouth, but also to give you as much information as we possibly can and make sure the information is accurate. So hang in there with us. We're doing the best we can for you. And we just need more continued cooperation, trying to be safe and use caution. Thanks, Steve.
Thank you, Dr. Barry Potvin. We're now going to move to Sarah Cloud. Sarah, you've heard all the other panelists. Anything else that you could add today?
No, I agree that the phase 2 process was starting Monday is very exciting, and we know it will take some time and a lot of patience. So, you know, as the previous speaker said, in the meantime, we know the drill, even though we may not like it. Wear our masks, attend to our mental and physical health, care for others, and just be patient. We'll get through this together.
Thank you, Sarah Cloud, Director of Behavioral Health. Dr. Christopher Campbell, you heard State Representative Matthew Muratore talk about the reaction to some school employees who are delayed now in the vaccine. What are your closing thoughts? You need to unmute. Chris, you need to unmute. Thank you.
Sorry, you think after a year and a half, you get used to it. My apologies. I think, you know, as Representative Muratore said, you know, everyone is anxious to get the vaccine, and there are a lot of people that we need to prioritize. And we'll be ready. We're here to support our educators when it becomes available. But, you know, there's light at the end of the tunnel. I keep saying things are much more hopeful now than they certainly were several months ago. But I just want to close by expressing my sincere appreciation for the tremendous understanding families have shown this school year. I would encourage anyone who may have questions or concerns to contact their child's school, speak to the principal, or call my office. We are always available to speak to you and welcome the conversation. I know that I speak for the school committee when I say that they welcome public comment and feedback. As we publish our weekly school committee agendas, details as to how you may join those meetings are provided at the bottom of each agenda. So it's no surprise to anyone that reopening amid a pandemic has provided a whole host of challenges for everyone in our entire school community. But having said that, our educators have been deeply focused on the quality of education for each child that they receive in their classrooms as best we can. It certainly hasn't been perfect, but our teachers and our administrators have demonstrated tremendous creativity in offering students a whole host and range of learning experiences since this pandemic began. So we've tried to achieve some consistency across the district while also giving each school and faculty flexibility to structure teaching and learning in ways that benefit the students that they serve, because they are unique in some cases. But our educators have done a remarkable job in an effort to best support our students. So I just want to end my comments by commending and extending my sincere appreciation and gratitude for just the tremendous work that they've all done and continue to do. We would not be able to reopen our schools without their support. Every one of our employees has worked harder this year than ever before. And I hope our entire community appreciates all of them, our teachers, our school nurses, our bus drivers, you know, our cafeteria workers, custodians, our counselors, and our maintenance staff, and so many more. So I just want to end my comments with that and turn it back over to you, Steve.
Thank you, Dr. Christopher Campbell. Real quick takeaways. Heather Cozby, your final thoughts?
I just want to, again, small business, keep being patient, keep working, you know, with everything you can, keep educating yourself, and, you know, go for your Ppp2 money and then deal with your forgiveness later. So that's about it. I appreciate everybody in this panel and the opportunity. Thank you.
Thank you, Heather Cozby. Steve Cole, same to you.
Yes, sir. You're going to be hearing an awful lot of this entrepreneurship center in the coming months. Some term that you're also going to hear a lot more of is entrepreneur. There's no shortage of creativity in this community. Artists can be small business owners also. So my sense is that if you are an artist or an entrepreneur and you appreciated the comments from the Poet Laureate at the inaugural, you know Plymouth also has its very first Poet Laureate. As a gift to the community, the foundation put up the money and held the process to select and identify a Poet Laureate. His name is Stephen Delbos. He is a Plymouth native. He spends half of his year under normal times teaching at Charles University, one of the oldest colleges in the world, in Prague. He's one of our own. He puts Plymouth on a list of places like Paris, Amsterdam, London. He has done the yeoman's work during this time of getting Plymouth out there and exposed to potential visitors when we finally get back to normal. Thank you so much for the opportunity, Steve. Really appreciate it.
Thank you. And we're going to have to close early today. PAC TV is supporting us each week, and every week we'll be here next Wednesday. Thank you for joining us. I'm Steve Triffletti, Plymouth Town Moderator. Good day.